class, it's Sarah Bergen. I wanted to show you the infographic that I created on quality and improvement strategy utilizing the NIM, which is also known as the Nerve Integrity Monitoring System. ENT really was my first love before I entered into leadership, so I thought this was a great opportunity to present this piece of machinery to you. So the NIM is a monitoring system that uses electromyographic monitoring for intraoperative use during various types of surgeries. And it monitors by using electrodes, and they're placed in the appropriate muscle locations in the patient for the procedure being performed. As you can see up here, this is an electrode placement for 4 channels. These are all the different places that the electrodes are placed. This is for standard electrode placement for an endotracheal tube, which has the electrodes built right into it. The electrodes are connected to the NIM monitoring system, which continuously monitors EMG activity from the muscles innervated by the affected nerve. When a particular nerve has been activated or stimulated, the NIM system warns the surgeon and the operating room staff, both visually and audibly, and shows right here on the screen here. Different types of surgeries that this machine can be used with are thyroids, neck dissections, skull-base surgeries, parathyroidectomies, laryngectomies, and substernal goiters. And down here again, it provides a continuous low-level periodic stimulation of the vagus nerve, which in turn stimulates the recurrent laryngeal nerve. It records responses by EMG endotracheal tube and electrodes, like the one I showed up here. It can show trends in amplitudes and latency in real time, which is very important, and has adjustable alarm limits for baseline changes. Many times throughout surgery, I'd have the surgeon ask me to increase these numbers here based on what type of surgery he's doing. Even with a detailed knowledge of anatomical and the surgeon's skills, motor nerves can sometimes be difficult to identify during surgery. This oftentimes can be due to different diseases, previous operations they might have had, and just normal anatomical variations each patient has. Big goiters can cause very difficult to be able to see the nerves. A lot of oncology patients, a lot of the tumors that I've seen in neck dissections have been wrapped around the nerve, and that's when these systems have been excellent in being able to maintain that nerve's integrity. So providing optimal patient care and patient outcomes for these patients, we're able to avoid damaging the facial nerve that controls all the movements and expressions, which can have a very devastating physical and emotional result for these patients. We never want to have facial paralysis. Provides prognostic indication of nerve and function, provides early warning signs of nerve damage and fatigue, and helps prevent false, negative, and or accidental nerve damage. During these certain types of procedures, especially during parotidectomies and neck dissections, patients can suffer temporary or permanent damage of these nerves if they're irritated too much. Sometimes minor irritation or stretching of the facial nerve can lead to temporary or permanent symptoms of nerve damage, like I said, such as paralysis, weakness, numbness, twitching. Severing the facial nerve is rare, but when it causes paralysis, sometimes that can resemble symptoms of stroke, which alerts the whole surgical team. When we watch for the laryngeal nerve, a branch of the vagus nerve, it's one of the nerves at risk during neck dissections, and that's also during the thyroid surgery. Damaging this nerve can severely affect an individual's ability to speak, swallow, and aspirate. Clinical evidence demonstrates the benefits of intraoperative nerve monitoring for nerve preservation, and this is the best tool for risk minimizing any damage to these nerves. Real-time results of nerve function after surgery decreases the stress of the unknown for the patient and increases patient satisfaction. Many times when seeing these patients before surgery, obviously they're very concerned about losing the facial nerve, having paralysis in the face, not being able to smile. So being able to know if any of this happened throughout the surgery is great to be able to tell them as soon as they wake up. Many times we ask them to stick out their tongue to smile in the postoperative areas, and at that time we're able to tell them that everything is just fine. So again, this is called the NIM. It's the Nerve Integrity Monitoring System. I think it's an excellent piece of equipment that allows for optimal patient care.